Hi, Dr. Yass here. In this discussion, I want to try to convey to people that are being told that the weakness they're experiencing is due to some sort of nerve issue, deterioration of a nerve, nerve degeneration that's being derived from the usual suspects, degenerative disc disease or impingement of a nerve, or all the same things that are found on MRIs that supposedly are the cause of pain are also supposedly the cause of weakness. And people must understand that the same principle of correlative theory is being applied here. All that's happening is you're presenting, especially if we're talking about the upper body, you're presenting with weakness in your arms. And so you seek care. You're told to get an MRI. The MRI finds the usual suspects: a herniated disc, stenosis, degenerative disc disease, some sort of structural abnormality in the spine. And because these structural abnormalities are identified for the first time, at the time of the weakness, they are asserted to be the cause of the weakness. It simply doesn't work like this. It doesn't work like this. I would suggest to you that for all those people who are sensing some level of weakness in their arms, that the primary reason for this is that there is weakness, literal lack of strength of the muscles that attach the shoulder blades to the rib cage. People must understand that the strength in your arms is derived from how stable your shoulder blades are to your rib cage. You must understand that the arm derives from its connection to the shoulder. The shoulder joint is actually the connection of the arm bone to the end of the shoulder blade. And the shoulder blade stability is derived from muscles, not joint capsules, not ligaments, that hold the shoulder blade against the rib cage. Now, if there is not sufficient stability derived from these muscles, then as much as you're trying to lift something with your hand, the shoulder blade will have a tendency to want to pull away from the rib cage. And as a result of that, the overall sense of strength in the arm will appear to be decreased. But if you were to individually muscle test the muscles of the arm, you would see they're quite strong. The deficit is not in the strength of the muscles of the arm, it's in the strength of the muscles that stabilize the shoulder blade. That is the missing link. And I have seen this innumerable times. All people who have been told that they have trigger finger or carpal tunnel syndrome or tennis elbow or golfer's elbow, which are actually incidences of pain, but still pertain to the same premise that the weakness that's deriving these symptoms is not from the location where the symptoms are being experienced. It's actually from lack of stability of the shoulder blade to the rib cage. So I want to make this very clear. There is zero evidence to prove that the weakness you're experiencing, like I said, primarily in the arms, I mean, the same thing holds true for the legs, but I think that this attempt to correlate weakness to the nerves really tries to happen in upper body issues. But the reality is that the associated weakness of the arms is not from nerve degeneration or any of these types of structural abnormalities identified on diagnostic testing. They are almost exclusively associated with lack of stability of the shoulder blade to the rib cage, which basically, in effect, makes the arm unstable to the rib cage. And as a result, any attempt to use the arm will present as weak. I implore every person who hears this, who is experiencing some sort of weakness of the arm, to schedule a Yass method session, treatment session, whether it's in person in Jacksonville or Zoom session anywhere in the world. And I could assure you that within 15 to 20 minutes of time, I can prove to you that this is the legitimate cause of your weakness and that it has nothing to do with some sort of structural abnormality which happened to be identified at the time of your weakness. And I can show you that your weakness can be overcome by you by understanding which particular muscles are involved in the weakness and understand how to perform the appropriate exercises using progressive resistance, which is at the core of the Yass method. And within weeks, you could see that the weakness and dysfunction associated with it will be resolved in just weeks. And you could end this dependence on the medical system, which holds you as prisoner because they're trying to tell you that the structural abnormalities identified are the cause. And as long as they're structural, they have a stranglehold on you. Well, if it's muscular, all you need to do is get stronger. So please, if you're having weakness, just like if you're having pain, I can assure you that the mere identification of structural abnormalities on a diagnostic test at the time of the weakness is in no way a representation of causation. It is strictly showing correlation, which is strictly saying that two independent variables can be seen at the same time. So please get the Yass method and let me help you very, very quickly end your weakness and obtain full function. If this video is helpful to you, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. If you would like to contact me by email to discuss your issue, please do so at drmitch@mitchellyass.com. If you would like to schedule a Yass method treatment session, again, whether in person in Jacksonville, Florida, or by Zoom, you can go to my website, Live Without Pains, that's plural, livewithoutpains.com, and schedule a session, and we can get you to the level of function you're seeking. And whether it's pain or weakness, irregardless, we can basically resolve these muscular deficits quickly and effectively through the Yass method and allow you to overcome your symptoms and return to full function. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.